Assalamu alaikum. Now the clinical station musculoskeletal. Examine 4 years old Arif. Arif has right knee joint swelling. So and do the musculoskeletal examination of Arif. So wash my hand and introducing myself, that me Dr. Roxana. Today I'm going to examine Arif's and it is involved looking at his joint, doing some movement. Is it okay? So as there is already exposed, I want to would you please mind if I ask some question to you regarding Arif's, does he has any kind of pain? Does he any kind of pain in the joint or any muscle? Does he have any difficulty in bracing? Does he has any difficulty in using a stair up and down? Okay, thank you. And now, as from a distance, I'm looking for, is there any dysmorphic face? What about the dimension? Is there any device such as wheelchair or any special shoe present or not? And then I will, as this is already exposed, so I will start from looking, just giving a general inspection about is there any asymmetry overall from the head to toe, any swelling, and the skin and the nail condition. I'm looking for in the skin for any rash and psoriatic rash, nail for the any pitting present, nail pitting present or not. And then just making some rapport with Arif. So just inspecting, as there is this obvious swelling, so I will start from this joint, knee joint, from the look, feel and move and then function. So look, I can see there is obvious swelling in present and there is no muscle wasting, there is no redness. So Arif, can I touch? If any point you feel the pain, just immediately tell me and I will stop there. And I will start the feeling, just measuring the feeling the temperature by the dorsum of the hand and when compare with the left side. And then after pain I will do for the effusion of this joint present, patellar tap present above the both joint or not. And then movement, I will tell the Arif, will you please move, bend your leg and then bend up this, open your leg. Okay, and here I'm looking for the active movement of this two joint, knee joint, both knee joint. And after this I'll make the flexion and extension passive movement. And after this I will look for the one joint above and the one joint below. So for the knee hip joint I will do the hip flexion, extension, abduction, adduction, internal rotation and external rotation. And from the knee joint, ankle joint, I will do the flexion, dorsiflexion, plantar flexion, inversion and eversion. And if there is time, then I want to do the pickles of the upper limb, back, and I want to see the gait of Arif. So if I see the gait, there may be a limping gait is present. Okay, and as there is, I find there is some restriction of movement. So to complete my examination, I want to do the anthropometry, want to see the vital sign and leg length discrepancy, anthropometry, and skin survey and slit limb examination, and also the pickles of the upper limb and the back, and whole skin, nail and hair survey. So what is the differential diagnosis? How so present your case? In the presentation today I examined 4 years old Arif who has right obvious swelling of the right knee joint. There is no muscle wasting surrounding it. There is mild tenderness is present. There is no joint effusion, but there is limitation of the right knee joint in compared to the left knee joint. So my diagnosis is a chronic inflammatory inflammatory arthritis may following GIA, may due to any trauma, hemophilia, leukemia, any kind of malignancy. So what if it's a case of GIA, what investigation you would like to do? So first of all, I want to take the focus history and review his previous note, and I want to I want to do the investigation, diagnostic investigation, anti-nuclear antibody, rheumatoid factor, and baseline investigation, full blood count with ESR, which may shows with CRP, which may shows the disease increase of the CRP. ESR shows the disease more progression of the active disease, and renal function test, liver function test, and imaging, extra of the affected joint, ultrasonography, MRI after consultation. And the management, and I want to do the formal eye slit lamp examination of the eye. So it's a management for the management for the arthritis, and management of uveitis if it is present. So first of all, management, acute management of the pain by the raised elevation of the limb, ice compression, and medication, NSAID, corticosteroid, methotrexate, disease modifying agents, and immunological, biological agent. And long term management, I want to go through by a multidisciplinary team, pediatric consultant, pediatric rheumatologist, ophthalmologist if there is uveitis, and occupational therapy, physiotherapy, and there is liaise with school, social support group, and I will keep him advice. And long term management, along hydrotherapy, gentle exercise, and what advice you want to do, give Arif gentle exercise to prevent joint deformity and maintain its function, straight guard bracelet, education about steroid side effect, coping with treatment, avoid live vaccine, yearly influenza and pneumococcal vaccine. And sometimes during examination, I want to complete my examination. If there is any features of steroid toxicity, we can see that. I also want to complete my examination. I want to see the side effect of steroid toxicity. What may be the bedside test for steroid toxicity? These are the blood pressure measurement, capillary blood glucose, and urinary dipstick. And this all about GIA, and it is better written in the mark between discussion on the GIA. So GIA criteria: age less than 16 years, duration of arthritis more than 6 weeks, and arthritis in one or more joint, which is defined as swelling or effusion or presence of the two or more of the following: limitation of the range of movement, tenderness or pain on movement, and there is increased heat. And types of GIA is oligoarticular GIA, where the less than 5 joint is involved, and polyarticular GIA, more than 5 joint is involved. It may be rheumatoid factor positive, rheumatoid factor negative. Systemic onset GIA, this is arthritis in one or more joint with intermittent fever for at least 2 weeks with one of the following. This is the evanescent rash, generalized lymphadenopathy, hepatosplenomegaly, serositis. And in case of polyarticular GIA, that is rheumatoid factor negative GIA, accounts for 25%, and it is most common in the girls. And arthritis may be symmetrical, asymmetrical, and temporomandibular joint involvement is present. Uveitis is rare here, and here rheumatoid factor negative, ANA is positive. Prognosis is severe arthritis and remission and relapse. And rheumatoid factor positive occurs most prominently in case of the girls, and the prognosis is bad. Here the rheumatic factor positive, ANA may be positive, and HLA-D4 may be positive. There is no uveitis, as sacroiliitis is rare, and the prognosis is severe erosive arthritis with poor functional outcome. Joint destruction and contracture can occur similar to adult patient unless well treated. And the complication of GI, most important complication is chronic uveitis, and sometimes this uveitis is asymptomatic, but if it is untreated it may lead to blindness, and ANA positive correlates with the risk of uveitis, and usually ESR, rheumatic factor, these are normal in normal in case of oligoarticular GI. And active uveitis is treated with mydriatics with steroid eye drop. And prognosis of oligoarticular GI is good. And other types of GI is psoriatic arthritis, enthesitis related arthritis unclassified. Enthesitis related arthritis most commonly occurs with boys, and enthesitis refers to the inflammation of the tendon insertion, typically plantar fascia, and tendo-Achilles is involved, and this may develop ankylosing spondylitis. Sometimes dactylitis is present here, and acute uveitis may present, and HLA-B27 is positive. And there is medical treatment and non-medical treatment in GI. Medical treatment we have discussed, and non-medical treatment in GI is hydrotherapy, passive movement, gentle exercise, split. Thank you. Assalamu alaikum.